Dr. Patel, good afternoon, Mrs. Khan. It's good to see you again. How have you been feeling since we started the treatment? Mrs. Khan, good afternoon, Dr. Patel. Thank you for asking. There's been some improvement. The pain isn't as sharp as before, and I've regained some mobility, but it's still difficult to walk for long periods or put full weight on my right leg. Dr. Patel, I'm glad to hear there's some improvement. Progress can be gradual, especially with nerve-related issues. Have you been able to follow the physical therapy sessions and take the prescribed medications as recommended? Mrs. Khan, yes, I've been diligent with the physical therapy and haven't missed a dose of the medication. The exercises help, but there are still moments when the pain flares up unexpectedly. Dr. Patel, that's not uncommon at this stage. It's good to hear you're consistent with the treatment. Let's assess your current progress. Please lie down on the examination table, and I'll evaluate your range of motion and any remaining signs of nerve irritation. Mrs. Khan, certainly, Dr. Patel. She lies down on the examination table, ready for the follow-up evaluation. Dr. Patel, after conducting the examination, your range of motion has definitely improved, and the nerve compression seems to be less pronounced compared to our last visit. The muscle strength in your leg is also gradually improving. That said, I can understand why you're still experiencing some discomfort, especially during prolonged activity. Mrs. Khan, that's reassuring to hear. Is there anything more I can do to speed up the recovery? Dr. Patel, along with continuing your current treatment, I'll recommend adding some low-impact exercises, like swimming or stationary cycling, to your routine. These can help strengthen your leg muscles without putting too much strain on the nerve. Additionally, I'll adjust your medication slightly to better manage the occasional pain flare-ups. Mrs. Khan, that sounds manageable. How long do you think it will take before I can walk normally again? Dr. Patel, it's difficult to predict an exact timeline, but based on your progress, I'm optimistic that with continued therapy and consistent follow-ups, you'll see significant improvement over the next few months. Full recovery can take longer, but we're on the right track. Mrs. Khan, thank you, Dr. Patel. It's comforting to know I'm making progress, even if it's slow. Dr. Patel, you're doing very well, Mrs. Khan. Recovery can be challenging, but your commitment to the process is commendable. Let's schedule another follow-up in 4 weeks to reassess your progress and make any necessary adjustments. Mrs. Khan, I'll do that. Thank you for your support, Dr. Patel. Dr. Patel, you're very welcome. Take care, and don't hesitate to reach out if you have any concerns in the meantime.